Well, welcome everybody. This is Diane Billings again, and I'm here with Marianne McGlure-Wilson and Janae Skinner-Hamler, two names that you recognize because they were scholars in the program last year, and they are now both in teaching positions, and Janae's going on for her doctoral degree. So who better to hear about how to succeed as a nurse educator and transition into the faculty role than to hear from two people who have done it. So let me say hi to everybody and then remind you that log in. I think you guys have all done that. We have everybody on mute, so when you want to speak, and I want to encourage you all to ask questions here. If you'll raise your hand, I'll kind of keep an eye on that, and we'll get some dialogue going here because I know you'll all have some good questions for our speakers. So we're going to cover these topics in various ways. We're going to talk about the challenges and opportunities during this first year and how to have a balance of a real life and your work life and all the things that are expected of you during your job. And everybody's mentioned a little bit about mentorship, so we want to be sure that you take advantage of finding one and being a mentee. For sure to talk about the doctoral education, and then we'll kind of wrap up with some tips for success. They're embedded throughout this session. And what I'd like to do is we're going to have Marianne go first and then Janae second, and we should give them our attention and let them dialogue with you guys. And then at the end, if there's time, I'll be glad to give you my best shot of some things to think about for developing your career and having a successful first year. But if we don't get to my comments, they're on the slides for you. So I think that's the game plan and the overview of how we're going to do this. So Tonya, how about passing the ball over to Mary Ann? And Mary Ann, welcome, and I'll let you start here, and you can introduce yourself because I know you've got some interesting things to say, and you can say it better than I can, but I'll certainly be saying thank you for giving up your time to prepare and to spend the afternoon with us.
Absolutely. Thank you. Hello all. My name is Marianne. I am a scholar, too. I graduated in May of 2011. I graduated in May with my
Are you wanting to get the slides to move?
Master's. Let's see if I can.
There you go.
There we go. There we go.
Okay, good deal.
There I am. Okay,
yeah, cute.
So, myself, I actually at first finished and I graduated in '95. I got my 4-year degree then, the first time. Then I went back to school in 2002 it was, and finished in 2004, and I became a nurse then. So I have, in fact, not been a nurse very, very much time. Then I went on for a little bit more schooling, and then we see from there on, and then I finished again last May. So I was very, very pleased indeed. I started working teaching clinical last summer, so that was my first semester. So I am in my third semester, marking my first year, and it's been wonderful, really, really great. First semester I taught clinical, and I taught for first let me talk a little bit about after graduation. My school is a little different than most in that we actually have 3 semesters or trimesters, each of them being 15 weeks long, which is a little different. What that means is that we do not have a spring like we don't stop for the spring, and all the semesters are exactly the same. Then one of the questions a lot of people always ask is how did I feel? And I think that being a scholar, I have learned so much. I really, really did. I found in myself that I knew more than a lot of my peers who were also new. And even comparatively speaking, I found that even some of the faculty which were there longer than I felt I was far more prepared. And there's a picture of us all, you see?
Mhm.
The first six, there we are. So the first semester, again, it was last summer, I taught 2 courses. I taught the clinical for the first semester students, and I taught 1 clinical for the last semester. I really like this so much because you got to really see how they are when they first come in, and then when they're all set. And I got to say, when they first come in, having been a nurse, and myself, I've only been a nurse since 2004, you kind of forget. And a lot of the students coming in have no healthcare background. And it was, so the first semester, I think, for me was a little bit difficult in that I sort of forgot how far that you, you kind of just forget. Let's see what else I put in here. So we have our foundations course, which I taught. In the first half of that course, they spend it at the school, and they learn how to take pressures and the vitals, all those exciting things, right? Then one of the many things, again, which really made that first time for me great was the fact that I actually knew the school well. So, and also having been in school myself, I felt that I did kind of know a little bit more how they were too. Let's see, what else is there? Things that I learned in my first semester. I really learned that you've got to really take out the time and prepare. You've got to prepare because of the fact that I just, since I was teaching the first years, and some of the things you just know how to do, but just because you know how to do them is not the same as being able to teach it. Also, things that I learned during the first semester was that Facebook may be great, but if you're trying to maintain a if you really don't want to put out there things that may not be too good. For example, there was a fellow faculty member. She had up her Facebook page, and the students cut and paste some of her pictures in her things, and there was pictures of her at the beach in a swimsuit and that type of thing. So you always want to think about that. Always. You want to, I really think most people or all people should look up and check out that if you typed in your name into Google, see what is there. Let's see what else. And I think don't forget to think of your the people that don't forget. At least in my school, all of the students have got a 4-year degree. So, for example, in my class, I've got students that are very young. They might be only 21. I have students that are 60. So I think you must not forget that you must treat them with respect at all times, at all times. Let's see. By second semester, before I move on to the second semester, is there any questions? I'm looking at the board, but I don't see any hands up.
Okay, I'll help look for those. And we can stop at the end of your, after you stop talking, I'll gather the questions up for you there.
Okay, sounds good.
Yeah.
Okay, so second semester was the fall. By now, so I, after my first semester, I thought this was pretty good, and I asked the dean if they were looking for people full time, and she said that they were. So I submitted a letter to the dean, and I interviewed for it, and I did get the job, and I was notified at the end of it was the end of the summer, so the very end of my first semester. So that was absolutely terrific.
Yeah. Can you?
Right?
Yeah, and we're proud of you. Can you say a little bit about what that interview was like? Because we had a session earlier this year about how to prepare for that interview or what it's like. And do you remember, or can you give us a few little tips?
I do. So I submitted the letter of inquiry. In that letter, I included my CV. I included a letter. I included a cover letter. I also included my portfolio that I made through the foundation. The interview process was on a panel. There was the dean of the actual program, the dean of academic affairs. There was 3 total deans and 2 professors there, so a total of 5. The interview itself lasted about an hour and a half, maybe a little bit more. That they asked me in regards to what I would do if, for example, what I would do if a student came in late. What would I would do if a student complained? What would I do if a student did not do as they were supposed to do? They asked me about testing, how I felt about testing, how I believed students tested. They asked me about my clinical experiences that I had with them the semester prior. They asked whether I like working with the first semesters more than the fourth. Let's see. I think that's it. It was more, but that's what comes to mind.
That sounded like helpful information, particularly the fact that it's just not a one-on-one interview, but that you're going to be probably talking to several people at once, and the kinds of questions. So those tips ought to be really helpful to the participants on this session. So thanks for that. Sorry to interrupt.
No.
So you can tell us now about the second semester that you then, after you had the full-time job.
Yes. So then the second semester, I taught the same 2 courses which I did prior, and they put on one more, which was a health assessment lab that met one time a week. It was for like 3 hours, I think. That totaled to 7. And at UMDMJ, to be full-time, you have to teach 30 TLCs, which is teaching credit hours. No, TCHs, teaching credit. Yes. So and so you can do 10, 10, and 10.
Uh-huh.
So the first semester I did that 7, but I got 3 credits sort of that you don't have to teach. What that is that you actually take a course. You take the first half the first semester, and then you take the second half. And you get, for taking a course, you actually get 3 credits, but you don't have to teach for 6. So you don't so that semester I didn't have to teach for those 3.
Uh-huh.
And then this one here too.
Okay. And was that course?
I don't know if I'm explaining it correctly.
Yeah. So was that a course that you were sitting in on to learn how to teach it, or was it a course?
Exactly.
Yeah.
It's a course that we only met one time per month, about or so, and we would talk about different topics. For example, we talked about how to test, how to grade, how to do clinical, student affairs, that type of thing. We only met once every 3 to 4 weeks, and it was for 1 hour and a half.
Okay, great. Well, that nice. Sounds like it's an orientation, faculty orientation program. Yeah, great. Okay.
What else? Second semester. So I put here that I took that course. We also get a iPod for faculty use. And here is all the things that we talked about, or that we will be talking about during the course.
Okay.
How to test, evaluation, item analysis, which is a complex beast.
Yep.
Yes, it is. Yes, it is. Things that I learned, particularly from last semester, is that I found it rather amazing. Last semester, I had in my clinical group, I had one student who had never been sick, never been in a hospital, so she had absolutely no kind of health care background. Then I had another student who had a master's degree in social work, so who had been in the hospital and was, very, very, who spent quite a bit of time in the hospital. So it was. I found it difficult at times to sort of find correct clinical patients and clinical tasks so that all the people on the team would all, at the end, come up to the same place. So another thing I found is that it is very important to listen to them, too. Because I find at times that a lot of the faculty treat them as if they're kids. And like I said, most of ours are, they're not. We have people in their 20s, 30s, 40s, plus.
Yeah. That's because you're teaching in that accelerated program, right?
Yes, exactly.
Yeah, so you have a kind of a different population than your typical undergraduate students.
Exactly.
So that sounds like a really important thing to consider when you're teaching students, is to understand who they are.
Let's see what else. So then moving forward to my third semester, which is now. So then during my second semester, the person who taught the course, she was about to leave. So then they thought that I could take on, take it on. So I spent quite a bit of time in the end of last semester with her, learning everything that she did. So then starting this semester, which I became the actual course teacher. Now by that means 1 day a week I actually teach the course, and I do a lecture too. And for all the first semester students, they take 5 classes. So to make sure all the courses are all planned out correctly.
Well, sounds like you moved quickly into a leadership role here.
Exactly. Yes. And then so that takes up 5 credits. Then I do my clinical, which is 3 more, and the teaching. So that's, let me think. So that's the 5, and then I do the teaching course. That would be 8. then 9, 10, 11. Yes. So this semester I'm doing 11. Okay.
Okay.
And then in the summertime, because I did 10 and then 11. In the summertime, I'll only be doing 9.
Okay.
Yes. And again, this is explaining exactly which courses I took.
Yeah, great.
That I did.
Okay. Full load.
Indeed. But it is exciting.
Good.
It is. Very, very. I think this might be 2 of the same slide, I think.
Okay, well.
Sorry about that.
No, that's okay. It was my fault. And Janae told me about having 2, but I didn't see him. So here we are.
Okay, so, oh well, right? So because I had taught clinical for that course in my first semester and my second, I had heard a lot of the students talking about lots of different things. So I tried my best to put in all those things into my course that I started this semester. For example, quite a bit of the course they had to do mandatory, but it was not part of the score. So I actually changed that for this semester. Like the med math, they had to do a lot of med math calculations, med terminology calculations. So I put that as part of their score for the semester. But it was just a small part. I put like 5% and 5%. Clickers. We began to use clickers this semester, which is a lot of fun. A lot of fun.
Good.
It is. Each class we do about 5 questions or so. Let's see what else. This semester I implemented a mid-semester eval. I used that online site, Survey Monkey.
Yeah.
I was trying to implement it into this PowerPoint, but I couldn't get it to get from the website into the slides.
Okay. Well, people can go out and Survey Monkey. I think it's by surveymonkey.com. It's a fun site.
Yes.
Easy to use, yeah.
It was a quick survey, only 10 questions long. Half of them I asked in regards to the course. Half of them was in regards to me. I was pleased to find that things are going pretty much well.
Okay, that's good.
I asked questions, for example, how do they find the course material? How do they like the book? What would they like to change? That type of thing.
Yeah, useful feedback for faculty. I think they have that. Yeah.
You know, why I thought it would be good is because the course evaluations, you oftentimes don't get time to fix up your course before you start your next course.
Mhm.
Like there isn't enough, time. So I figured I would give that a shot.
Okay. And something to, plan for budgeting into your time to gather that information. Yeah. Okay.
Exactly. True. Also this semester I will be going to a conference that is next month for ATI. We do ATI in the school. I don't know if all the schools do ATI. Do they now?
Many schools use some kind of assessment. There are several commercial companies that do those, and they're certainly help the students prepare for the licensing exam. That's the whole purpose of using those standardized assessment systems. Yeah.
Okay.
So you get to go to a conference, you lucky person, you.
I'm excited about that. Indeed. Very, very. So, and our school is moving to 7-week semester starting next summer.
Okay.
Which is a major task, trying to get all the, all those things all fixed up, worked out. So I'm on the task force to work out the courses to how to get them from being 15 weeks down to 7.
Okay, so you're serving on a committee already, doing service to your school. In addition to your teaching, and continuing your faculty development by going to that conference.
Exactly.
Yeah.
And let's see. For my third semester, what have I learned? Optimism is wonderful. Optimism, optimism. Because I would say that just because since I'm teaching the first semesters, they are dealing with so much. It's their first semester. They don't know where's the school, where to park, how to test. It's all new. It's. So in that regard, they can be, they need a lot of time, a lot of time. Number two, I say to assume good. You always want to assume good because if not, things can get very, very tough. And I truly do, that, the students, they are just there and they're really trying hard, And let's see.
Marianne, can you give us your next slide? Because I think you're talking from one that isn't showing on my screen. So give that next.
Oh, okay.
Give a little next one here.
A little flip.
Yeah, there.
There it is.
Okay,
there
good deal.
It is.
Yeah.
There it is. Assume
okay.
good. There it
yes.
is.
Okay.
And I also do not start something that you cannot finish. For the first test I gave, I did not give out a blueprint. Second one I did, and now they're like, please, 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 please. And it turns out that it takes a lot of time up, a lot of time.
Okay.
A lot of time. So those were the major lessons that I learned in regards to this semester.
Perfect.
Last thoughts.
Thought. Give us another slide. There you go.
There it is. There it is. You must find yourself a good mentor. Absolutely. It's important. It's important. It's important. Right?
Yes.
I think when you are going for when you're looking for where you should be, you need to know like what the school does, what that job will expect of you, and what else is there? Did I put here? The last point is that you always want to remember that, you have dreams, but they do too. They do too. Any questions?
Yeah, let's open this up because I imagine quite a few of you are going to be, assuming a faculty position here, and while we'll have Tonya give Janae the ball here while we have these questions, but you guys, what questions do you have for Marianne? Marianne, you've had a really full first year and have done a lot of interesting things.
Right?
yes, and some that you probably anticipated and some that you didn't. So what else would you like to know from Marianne about her first year? Because she's really a good example of a full-time faculty member, and how she started with the adjunct role and then ended up into a full-time position. So questions at this point? Okay. We have a question from Karen. So Karen, unmute yourself. *6.
Hello.
Hi, Karen.
Hi, Marianne. Well, first I'd like to say congratulations to you. Excellent job. Excellent
job. Thank you so much. Thank you.
And you are definitely an inspiration for me. I am wondering, I know that you also received your degree as a family nurse practitioner.
I did.
Yes. Do you anticipate blending that, working as a family nurse practitioner, as well as the faculty role that you are quite, consumed in right now? Do you see that coming along? And then I also wanted to find out what the initials ATI stood for.
Okay. excellent questions. Yes, I graduated last May. I took the boards over the summer. I am indeed a certified family nurse practitioner. I work at a Minute Clinic. Minute Clinic. I'm not sure if you're familiar with them. It's they are owned by CVS.
Okay, I've heard of it, yes.
Okay. So I actually just began. I began to train, and I should be done with my training in 2 more weeks.
Mm-hmm.
So I'll see how that goes. In
Yes.
regards to faculty practice, that's the place I would like to be at. I'm still trying to figure out the specifics of faculty practice at my school. By that I mean, for it to qualify, you have to make a certain amount. Like, you have to be getting paid a certain amount for it to qualify as faculty practice. So I'm not certain if this will qualify or not.
And will you get release time?
Yes. Yes.
That'll count as in your workload credits there?
Exactly. Faculty practice counts as either 2 credits or 3 credits.
Okay.
And Marianne, I wanted to also ask you, did you initially have a mentor to guide you through this new faculty role, along the way, at least part of the year?
Well, I was taking that course, so that was last semester and this semester. So I would say it's a yes and no. I had the deans there constantly. Like, I would meet with them, and they would meet with me, and they would come in and see me quite a bit. So that really, really made me feel good. I share space with a faculty member. She has been there about 5 years. So she explained a lot of things to me as well. And my mentors and the people that I have worked with all throughout the time, I still talk to them too. Like, for example, Dr. Kaminsky, so I would say yes, I do.
Great, thank you.
Okay. And you asked one other question about ATI?
Yes. Mm-hmm.
What was the...
She wanted to know what it stood for.
ATI, what does ATI stand for?
Assessment Technology Institute. So I guess that's just the name of the company.
Mm-hmm. Okay. There it is.
Yeah, it's a commercial company that provides testing for students to help monitor their progress, particularly toward the licensing exam.
Oh, okay.
Lots of schools use it, with the students. Okay. Any more questions for Marianne? Thanks, Karen, for your good questions.
Thank you.
Got some good ideas out. So I think what we'll do is we'll go ahead and have Janae share her experiences, and then we can come back and ask more questions, and you can direct them to anybody. So
sounds good.
Okay.
Thank you, guys.
Thank you. Okay, so Janae, I think we're ready for you. Do you have yeah, you do. You have the ball.
Yes, I do.
Okay.
Yes. Good afternoon, everybody. My name is Janae Skinner-Hamler. I'm a registered nurse, master's, and family nurse practitioner. I sit for my boards on April 30th, and I will explain to you later why I waited so long to sign up for my boards. Right now I function in the capacity as a clinical field specialist. I work for a local community college as adjunct faculty for clinical nursing students at a hospital, med-surg. I did med-surg students last semester, and this semester I took on first-year, second semester students for med-surg, and I also took on an OB clinical rotation as well. And with me, I started out as an LPN. I was an LPN for 12 years. Came to work one day, was told that they were doing away with the LPN, so I transitioned from RN to BSN to MSN. Right now, I am currently a doctorate student at Wilkes University, and this is my second semester, fourth course. Developing your identity as a clinical instructor, it was a little hard for me in the beginning because, the students, they have so much expectations from faculty, and actually just for once being on the other side of the fence, was a little unfamiliar territory for me. But as a clinical instructor, I would have to say that my greatest responsibility was developing a combination of teaching strategies that results in effective learning by the students during their clinical rotation. So with that being said, I try to get them, I try to follow their objectives that they're learning in lecture and transition them over to the clinical setting. And most of us, we have significant memories of our nursing school experience. Some of you may remember having an instructor who was very mean. Some of you may have a clinical instructor that you may have been, felt a little intimidated by approaching. But for me, I had a clinical instructor who was trying to walk me through giving my first IM injection. And I don't know if many of you are familiar with the medication Demerol, Vistarol, where you had to mix them together and use the Carpoject. Well, when I went to give my shot, I didn't know the difference between the generic and trade names, so she would not allow me to proceed with the injection. So, I mostly, for me, I mostly remember some of the bad more so than the good. And personally, I used to shake in my boots a lot in fear that I would not be able to answer questions, if the instructor called on me. And in the clinical setting, you have to really be patient with the students, answer their questions. It's not what you say, it's how you say it. So, I tell them from the very beginning, I'm not here to be your friend. I'm not here to spoon feed you. However, this is, a learning experience, and, I'm going to help you take everything that you learned in theory and apply it in the clinical setting. And I feel like those past experiences that I've had have helped me to appreciate the knowledge and the expertise that faculty, constantly is bestowing upon me to help me achieve the same level of experience with the students that I have today. So I feel like my past experiences have helped me develop my own sense of identity as a clinical nursing instructor. The body of knowledge that supports the nursing profession, it requires effective clinical teaching strategies for effective learning to take place. So if you're going to be that mean instructor, mean clinical professor, and, do you really think that your students are going to gain anything from that clinical experience other than fear? Now, I'm not, unlike Marianne, I'm not full-time, I'm adjunct, so, there's a lot of challenges. Either way, there's a lot of challenges, but for me, here are some of the challenges that I've come across. Getting to know my nursing students, who are the best and who are the rest. Because, there are some students that are going to stand out and who are going to be very smart, and then you're also going to have the rest of the students, maybe your not-so-good clinical student, your mediocre students. Also, screening your higher achieving students versus the mediocre students, like I mentioned, because sometimes mediocre students feel like they're just that, and that if they're not, achieving higher success, that the clinical instructor will not pay a lot of attention to them. And that's not the case with me. You will have problem students. They always want to go against the grain. They want to be disruptive. They want to come to clinical late. They want to challenge the nurse that they've been paired with for the day. And to me, that's a form of incivility, because if you go to a nurse that I pair you with and say, listen, I told you that so-and-so was in pain and you still haven't medicated that patient. Why haven't you medicated that patient yet? The nurse is going to look at that student like, that they lack professionalism. So also when I have pre- and post-conference, I have discussions, and I often wonder, I don't want it to be boring. I really want them to learn from it. So sometimes what I have them do concept maps of a particular diagnosis that their patient may have had the week before. And I let them do it in pairs. I don't want them to feel like, I have other things to do. I have to study and worry about getting a good grade. I don't have time to do your concept map for clinical. But I have them do that. We agreed on it in the beginning of the clinical semester, and actually they like it because it helps them to pull out the pathophys, the risk factors, the causes, and the prognosis. So that's going pretty well. You know, sometimes with clinical, one of the issues that I had, we went to clinical one day and the floor was shut down. The census was low, and no one sent me the memo, but they were combining the two floors. So they thought that I was going to let them go home for the day, and I said, oh, no, we'll all drive back to the college and we'll make this a lab day. So they didn't really like that, but they didn't have a choice. And, you know, and then alternative assignments, just giving them different things to do. You know, they do have mandatory assignments that are due, but sometimes just giving them alternative assignments, like having them write their meds out on, you know, the little flashcards and writing down, you know, some side effects of the meds that they commonly see while they're on the floor. And like I mentioned before, the punctuality and the clinical absences, you know, everybody has an excuse. And I'm not saying I'm heartless and you know, I don't lack empathy, but honestly, you know, your reflection of how you portray yourself to me on the clinical setting, you have to, you know, you have to be very well, because you're going to come to me at the end when you're graduating and you're going to ask me for a letter of recommendation. And I'm not going to provide you with a letter of recommendation if you've been coming to clinical late, if you've been disruptive, or you always have an excuse to why you need to leave early. And, you know, and finally, the students' expectations, they expect us to know everything. They ask you a question, and they think, I want the answer right now, like instant gratification. So, you know, as a faculty, you may not know everything, but what you can say is, okay, well, if you don't know about that, how about you go look it up, and then, you know, research it a little bit, and then come to me, and when you come back to me, we'll talk about it, or either we'll discuss it at post-conference. So that's how I deal with, you know, the students that expect the faculty to know everything. And what every clinical instructor needs to know, and I'm not going to go through this whole list, but you need to become familiar with the unit. If you're going to be a clinical faculty, you need to go to the hospital. You need to introduce yourself to the staff. You know, how do you go to a clinical setting and you haven't, you know, assessed the scene or introduced yourself to anybody or know where to find supplies, and then you expect the students to know? It doesn't sit well with the staff at the hospital. And also you have to think more like a teacher and less like a nurse, because sometimes you can find yourself saying, oh, well, if I was the nurse for this, I would do this. You can't do that. You have to maintain the teaching role. Also, you want to enhance the student, you know, to perform. Like, I'm supervising them, and it's not just all about performance, because they're like, oh, I'm so scared. I've never done this before. And, you know, I just let them know, relax, take a deep breath, try to remember what you did online, or some of them have Elsevier. I try to tell them to avoid YouTube, because when they watch YouTube, they compare everything that they saw on YouTube to the clinical setting. I try to have them use whatever was referenced in their syllabus. If you're supposed to use Saunders or you're supposed to use Elsevier, then that's what you should use. Also, know the relevant student policies and handbook, because a lot of times, like, you can say something to a student, like, for example, they're not allowed to have cell phones on the floor. They're not even allowed to have PDAs on the floor at the hospital where we are, because the hospital has reference software on the computer, and they feel that this way it will prevent any, you know, violation of HIPAA or any wrongdoing or malicious acts. So a couple times, you know, I've seen a student with a cell phone, and I say, okay, well, you know, page 18 of the student handbook clearly states that you are not supposed to do this. So, you know, once you tell them that, then they have a clear understanding of everything. Understanding informal and formal organizational structure of the clinical site, as well as the School of Nursing. You need to do that. As adjunct faculty, you know, sometimes adjuncts, they think like, okay, well, I'm just an outsider and I don't need to know all of that. I'm only here for a semester. That's not true. You need to know the informal and the formal organizational structure of the hospital, the clinical site, and the School of Nursing. And basically, you know, your goal as faculty is to facilitate communication among the staff and the students. You definitely want to steer clear from any conflicts. And remember that we are not placed in a clinical setting to be friends with the students, because, like Marianne mentioned, they want to Facebook you, they want to Twitter you, they want to be your friends. They were like, oh, Professor Hamler, we're all going out to have a drink after clinical. Would you like to join me? Absolutely not, but thank you for the invite. And most important, whether you're a full-time, part-time, or an adjunct instructor, you're basically contributing to the profession that is in great need of successful instructors. And, like Marianne and myself, we're new to this, so, we have to go in and we have to raise the bar and prove that we are capable of functioning in this capacity and, and teach the students how to effectively care for their patients, whether it's in the lecture or whether it's in a clinical setting. Some of the advantages and disadvantages of being adjunct faculty, the advantage might be the financial gain. You are compensated very well, but that should not be your only motivation to, become a clinical instructor. You can work as a staff nurse during your periods off. So, usually, I'm adjunct, I work 2 days, so I have the rest of the 5 days to do, if I want to work somewhere else as a staff nurse, or if I just want to take off and stay home or study for these doctoral courses, I can do that as well. It's very flexible. It's the flexibility to work and pursue your PhD or your doctorate or whatever you decide to study. And it's just a feeling of accomplishment when, your students say, they get that aha moment regardless of what I'm being paid or how long I've been there. It's just good because I'm just know that I'm doing something positive and I'm sharing everything, as much knowledge that I have and clinical experience that I have with them to help them understand and, put all the pieces together. And, just staying focused on the clinical objectives, that's positive as well. The disadvantages of clinical adjunct is you're not, you may not get called back next semester. You may not being able to get tenured, the lack of benefits. You may, if you are not adjunct faculty and you're a regular educator, you may get paid less. But like I said, you really shouldn't worry about that because essentially your desire to teach is what brought you to this position in the first place. All right. I'm not going to read all of that on the slide. I'll just save that for you to read later. You want to encourage your students to assume responsibility for their clinical learning experience. And I've listed 3 ways to foster responsibility. And, as a clinical instructor, it's my job to foster and encourage the students to gather the information and remember it throughout their clinical day. And not just their day, their future, to take it with them when they're in school and they're taking an exam and they may say, oh my goodness, I remember, Instructor Hamler mentioned that to me in clinical, and this will help them pull out the answer. You also want to encourage the students to be responsible by thoroughly reading each patient's chart, their medication list and their care plan. I do tell the students, however, because last semester I had a real problem. They wanted to stay at the computer and just gather all this information. And I'm like, your S-bar is not that big, so you don't need to gather all this information. You just need to kind of gather the snapshot, and then you should go to the bedside because at the bedside is where you as the student nurse can get the most subjective information from your patient. And also you want to remember that you can't be in every place at one time. So I tell my students, it's okay to seek guidance from the other nurse that you're assigned to. You don't have to just, run to me all the time because sometimes I'll be with one student giving a med and then I'll have 3 students standing at the door eyeballing me and the other student. And I'm like, oh, can I help you? Oh, we have a question. Okay, do you think you could ask the nurse that you're with or do you really need me to answer that question? Oh, I didn't know, Ms. Hamler or Professor Hamler, I didn't know that I could ask the other RN. Of course you can because this is the primary RN assigned to that patient. And conclusion, you want to always remember that you are helping to educate nurses whom you would want to care for you and or your family. And there is no greater satisfaction than realizing that your former students are surpassing you in knowledge. And
okay.
I
did about 10 more minutes, so
okay.
We want to hear about your
Okay,
program.
I did post a couple slides about advancing your education, and I'm not going to read that since they'll have access to the slides, but I will share with them why I chose to be, go back for my doctorate. And the main reason why I decided to pursue my doctorate as many of you have heard, that nursing is the only profession that really hasn't raised the bar. Like, if you are going for pharmacist, you get your PhD. If you go for a physical therapist, it's PhD. So with that being said, I said, you know what? I'm going to be one of the many who will raise the bar. I'm going to go back and obtain my doctorate. And as doing this will help me to meet the complex needs of patients that I'll be treating, whether, as a nurse practitioner or a nurse educator. Pretty much there's like a lot of evidence out there to support why you should return to school. And, there's also a lot of debate. A lot of people go, well, I'm not going back to school. I can't afford it, and I'm already skilled. I'm already knowledgeable. I'm already a professional practitioner. Why should I go back? Well, like I said, there's a lot of evidence out there to support it, and I'm sure a lot of you, since you're on a master's level, you probably have been exposed to the IOM report. And basically with that report, they're basically calling for a better and educated workforce. So with that being said, the higher level of education you receive, the more prepared you are to promote quality and excellent care or excellent nursing practice for your patients. And a perfect example of that, if you look around, is definitely relevant. The ANA has developed the magnet recognition program. So a lot of hospitals are trying to obtain magnet status. So with that, they're saying, like, okay, we're going to provide and deliver excellent patient care, and we're going to do this by having a greater percentage of baccalaureate nurses on board. And, even hospitals are even hiring MSN-prepared nurses as well to function in a capacity as hospitalists because where MSN students that have their nurse practitioner, of course. But where I work, what they've done is they made this, how can I put it? A lot of the doctors have almost kind of been booted out a little bit. And what they're doing is, like say, for example, if you had Doctor Who, and you're Dr. Who's patient, and you come in, you're admitted to the hospital, then Dr. Who has privileges to come in and see you while you're in the hospital. Well, now what the hospital that I work for, they're asking the doctors to sign on board, and if you don't sign on board with them, what's going to happen is if you're Dr. Who's patient and you come in and Dr. Who didn't sign on board with them, then you'll be seen by a hospitalist. So that's, that's what the point that I'm trying to get across, that, the MSN, they are hiring MSN prepared nurse practitioners to function in that capacity as hospitalists. Some of the options that you might consider for returning to school, a lot of people say, I don't want to return to school because it's too expensive. I have to put my kids through college. If you can't afford it and it doesn't bother you, you can take out, apply for financial aid. And another option is, a lot of people say they don't want to go back to school because they don't want to sit in the classroom. Well, I just want to let you know there are a lot of, quite a few DNP programs out there that are hybrid, and you can get your online degree, and you'll have that flexibility, and you don't really have to be on the on-site classroom meeting. So, you can consider that as well. If you're going to decide to go back to school for your DNP, you want to make sure that the school is accredited. You want to check out the cost. You also want to see if, like for me, I had to make sure that they had enough faculty because I don't have to do a dissertation because I'm not going for my PhD, but I'm going for my doctorate, so I have to do a scholarly project. And with that being said, the school that I'm going to, they only have, they're only allowed to have a maximum of 3 students, for the project. They can only function as a scholarly chairperson for 3 students. So let's just say 3 of you were going and you were supposed to graduate this May, and then any unforeseen circumstance came up and you couldn't graduate this May, then you're already assigned to that person. But somebody like me who's transitioning to the next semester wants to start my project, I can't because there may not be enough enough scholarly chair people available. So you want to make sure when you're choosing the right school that you ask those questions. And, if you decide you want to return for your doctorate, just get yourself ready. Do you make sure you have a good support system? Definitely you want to make sure you improve your computer skills, and you need to get that APA reference manual and study it like it's the Bible, because it's no fun, working your heart out on the paper and you're getting dinged for so many APA errors, whether it's like italicizing or anything. So definitely you want to, take heed to that. And also, I know this may sound a little corny, but you might even want to befriend a librarian because they can really help you a lot, during your educational experience. So that's pretty much it for me. And if anybody has any questions for me, I would be glad to answer. Advance those last couple of slides there. And thank you, Janae, for sharing your insights and giving us all this practical advice. And you've taken a little different path than Marianne did. You're working as an adjunct, but you're also going on for your doctoral degree. So that's what kind of questions do you have for Janae? And I'll say that probably Janae and Marianne both, where they are. They are in your LinkedIn. I think both of you are in that LinkedIn, so if you want to reach them professionally through that would be, the NJ and I, our special LinkedIn group there. So feel free to add or ask some questions there. So any questions or comments for either Janae or anything back to Marianne? Okay, and Janae, can you, since you have the ball there, just push those next couple of slides for me to look at? Okay, and there, I think you've done that. Mm-hmm. Okay, there, move one more or two. Yeah, and we have some references, and actually, here, I can just wrap this up. Go ahead and read these last slides. Those are my words, but I think your colleagues have said them all the same. I want to thank our guest speakers. They have put a lot of time into developing the PowerPoints and putting their thoughts together. So I appreciate the time that they've given to share with you and then to spend this Friday afternoon with you too. As you know, we're going to be meeting again at the Foundation for our April meeting. That's, I think, it's April 20th. It's a Friday, basically the entire day. I'll be recruiting you all for your posters, so this will be a chance to do some scholarly work. See anything else I should say? Thanks to Tonya and to Gerald for being our tech support here. Tonya from the New Jersey Nursing Initiative and Gerald from the WebEx. So I think we have about 3 minutes left for some questions, and I believe Amelia had a question, but she put her hand down.
Okay, thank you. So Amelia, do you have a question and *6 to?
No, actually, I just wanted to say thank you. It was a wonderful presentation, and I appreciate their sharing their experiences. It's very helpful to a lot of us.
The real world of the first year after graduation. And I'm going to do a shout-out to Primrose Germain. She as a alumni, too, and I hope she would be available to you all to give you the information about your first year as well. So any last comments or questions? Yes, and look at all the smiley faces.
Thank you.
Exactly.
Okay, and Marianne, and do you want a last word, or Janae?
No, I just want to thank everybody for participating today. I know sometimes when it is Friday and it's nice out maybe where you live, not here, it's a little cold, but you want to go out. But I really appreciate you taking the time and listening. And I thank you, Diane, because I was honored that you asked Marianne and myself to present to the scholars.
Well, you guys did a fabulous job, and you are the real world out there, what it's been like. And, we all at the Foundation hope that the program that you were in helped, kind of smooth some of these transition issues. And I feel proud to hear all the things that you've been able to do and the experiences that you've had. So it was a thrill to hear back from both of you. Yeah. Okay. Anything else? Well, I'll see most of you next month, and we'll wish everybody happy events that are coming up, whatever they may be. Certainly tomorrow we'll celebrate St. Patrick's Day.
Yeah.
Okay. today, or is it today? Am I supposed to be celebrating that? It's tomorrow.
Tomorrow.
Oh, okay. I'm already jumping the gun. Okay. See you all. Bye-bye.